Welcome to the show and thank you for joining us. This is Health Matters on Channels Television. I am Mary Alale Yusuf. More than 303 million confirmed cases of COVID-19 are on global records with a death toll of over 5.4 million. In Nigeria, the count is over 247,000 confirmed cases and 3,070 deaths. Global vaccinations are edging closer to 9.5 billion. In Nigeria, we have over 11 million first dose vaccinations and over 4.7 million fully vaccinated people. Now, in a bid to address a shortage of primary care physicians, Eugene Stead Jr., MD of Duke University Medical Center in the US, put together the first class of physician associates in 1965, using his knowledge of the fast-track training of doctors during the World War II. Physician associates, called physician assistants in some climes, are trained health professionals who provide crucial support to doctors and have regular direct contact with patients as part of a medical team. My guests, people who want to increase the health workforce in this manner, are Dr. Mayomi Abimbola, physician associate in Dallas, Texas, joining via Zoom, and in our Kano studio, Mohammed Hassan, former director, legal drafting at the National Assembly and retired Secretary, Legal Services, National Institute for Legislative and Democratic Studies. He's currently a consultant for both institutions. You're welcome to the show, gentlemen.
Thank you very much.
All right, let me start with the PA. This physician associate, when I heard about it, read about it, first thing that came to my mind was, is this a nurse? You answer that.
It's a great honor to be here. So physician associate, mid-level medical practitioners trained in the medical model. So we nurses are trained as nurses, and our PAs are trained using the medical models, and they are trained like medical doctors. So instead of medical doctors spending like 4 years in the medical school, physician PAs have to undergo just 2 years of accelerated training.
Let me follow up with one more question.
Okay.
We've heard of paramedics. We have them, I don't know if we have them in Nigeria, but we do have them abroad. People who hurry up to the scene, maybe there's an accident, they're the ones carrying the stretchers, checking the pulse and all that kind of thing. Is that the same thing as a physician associate?
They are trained in medical models. Paramedics, they are different entirely. EMT, they are different. Nursing, different. But like you rightly said, doctors, because of the shortage of medical doctors, they have to devise the physician associate profession in order to be able to help the doctors, making sure that we provide medical access, healthcare access to people. So PAs are able to do everything that medical doctors can do. The only difference is that a PA must have a supervising physician. So this supervising physician doesn't have to be within the 4 walls of the same building. The only important thing is that that person should be available at least over the phone. So if you run to a particular problem, there is a supervising physician that you can easily call and that will assist you. So PAs, we are able to do everything that medical doctors are able to do, except that we must have a supervising physician.
Ask Mr. Hassan, how do we tackle this legally? Is there a legal framework for introducing this kind of thing into the health system?
Yeah, yeah. This concept is, to me, is a very beautiful concept. Even though we don't have it in place in Nigeria, but once the proposal has been introduced in the Parliament, we all know Parliament is an institution that consists of elected officials from different constituencies and from different senatorial districts. They have their own background, knowledge, and experience. So any proposal that is before them, they are going to subject it into public scrutiny. They themselves are going to look at it critically, and they put it on the scale of balance. So they are going to look at it, the merit and demerit. And of course, if it is beneficial to the Nigerian community, then the bill will be processed. And there will be a particular legislative stage where, if it is introduced successfully, it will be read the first time, the second time, and the entire members will debate on the general merit and the merit of the bill. If it survived that stage, it will be referred to the committee, and the committee has been authorized by their standing order to invite professional stakeholders as well as general public, and then test their reaction, test their response. If it is okay, then the committee knows what to do for further legislative action. So to me, it's a noble idea, and you won't know until it is introduced into the Parliament, and then you see how the parliamentarians will do justice to the concept. I believe if it is introduced, it will be welcomed by the Parliament.
Okay. Mr. Hassan, one further question. Here is my concern now. The PA has told us that a physician associate is a mid-level health professional. But he is not in Nigeria right now. I don't know if he has experienced this or experienced it somewhere abroad. You are aware of the trouble that goes on within the health sector between the different cadres of health professionals, you know, talking about what level they should be on, how much they should get, how they should be addressed, and stuff like that. And here we are trying to introduce something extra. Are you thinking about that? Are you prepared for that battle?
Well, yeah. If you look at the bill, the content of the bill, it is a bill that consists of about 17 clauses, and each clause has substantially addressed an issue. Now, you remember, even in the same health sector, we have different regulatory bodies dealing with different professionals. For example, we have regulatory body dealing with pharmacies, you know, lab technicians, and so on. So the whole idea, since this is a new concept we are trying to introduce, we have somebody may raise the question of who is going to finance the activities of this physician associate. Now, if you look at, we have a particular clause in the body of the bill. We are not going to create any burden on government. The institute that's going to regulate that profession is going to generate its own money through fees, subscription, donations, gifts, and so on. So if anybody raises the question of finance, I don't think there's going to be any problem about that, because internally the institute can generate money to fund its own activities. And in looking at this proposal, we have to be very, very objective, and then understand the significance and the advantage of having this set of professionals that will constantly assist medical practitioners. Remember, we have in Nigeria a very large population, and most of our populations are concentrated in rural areas. So where access to medical services is very, very difficult. So with this kind of arrangement, there will be opportunity for employment, and then there will be easy access to medical services in those communities, in those rural areas. So it has a lot of advantages. We have to look at it objectively and rationally, because by the time you put sentiment into it, then you won't appreciate anything good about it. But we have to look at it objectively.
Okay,
and I'm
thank you
very
much.
sure that by...
Let me throw a question to the PA. You have said that the study is on the line, is a physician line and everything, but obviously it's 2 years. It's accelerated, like in a third of the time that a doctor uses to study. So what I want to ask you is specifically, what is the course of study? Do they do physiology, anatomy, you know, biochemistry? What do they do? Because the public has to trust that this person is good enough to handle my issues, even touch my body.
Thank you for the question. Yes, the PA profession, like I mentioned, is modeled towards the medical profession as well. But the difference is that, for example, neurology, medical doctors may, during their didactic care, they may spend like 2 months, you know, just treating neurology alone. But for PA profession, PA program, neurology may be taught within 2 weeks. So what they taught, the medical doctors were taught like within 2 months, that everything has been compressed such that the PA program is it's an accelerated program, and people are subjected to intense medical training. So instead of spending a month on a particular topic that we're taught with medical doctors for 1 month, for PAs it's only 1 week. So it's the same, the course content and everything are the same. The only difference is that the duration, the length of time. So for PAs in the US here, you have to have your first degree. So you have your first degree maybe in sciences, maybe art, maybe any profession. Once you have your first degree, then you will now be subjected to some examination, and then eventually, if you find yourself lucky to get into the PA program, it's a master level program in the US. So you must have your first degree, then have your master's in physician assistant associate studies. So at this point, that's when you can start practicing. So eventually, if you look at it, a PA will spend 6 years, 4 years of bachelor, then 2 years before he or she can start practicing. As medical doctors that will go to university probably for 4 years and go for medical training, medical school for another 4 years. So like I said, the contents are the same. The only difference is that the medical doctors have in-depth understanding and in-depth knowledge going by the level of training that they are subjected to. And that's why a PA has to have a supervising physician that he or she can call on, if there's any problem. To quickly buttress MD's point in terms of the need for this profession in Nigeria. So this profession was introduced in the US when there was a shortage of physicians, primary care physicians. So in Nigeria today, we have marked shortages. So UN WHO recommendation, it's 1 physician to 600 patients. But in Nigeria today, we have 1 medical provider to about 6,000 people. So we have a lot of people dying, not able to get medical treatment because we have a non-availability of medical doctors. Unfortunately, most of our doctors are leaving the countries now, and if care is not taken, if the leaders do not do anything at this point, you get to a point that it's going to be, that number can increase from 1 citizen to 10,000 people. And to be honest with you, at this point, it's a national emergency. It's something that the government should step in and make sure that the PA profession gets gazetted and they get enacted, and the profession can start flourishing. There are so many other countries in Africa that are utilizing PAs. So they call them clinical officers, clinical associates. But we want to model the PA profession in Nigeria such that a PA in Nigeria will be able to practice in UK, in the US, in Canada, without necessarily having to do any serious education or board exam. So if you are a PA in Kenya, for example, if you travel to the United States, you have to go through the 2-year program, the PA program. But the model we are trying to establish in Nigeria, if you're a PA in Nigeria and you pass the board exam in Nigeria, you can just come into the US and take the board exam and be able to practice as well. So if care is not taken, like I said, we may run ourselves into to a point that it will be difficult to get healthcare access.
Okay, so we'll continue the discussion. There's some other things I'd really love to ask you, but we're going on a short break now. Stay with us. When we come back, more about the PA. Welcome back. It's Health Matters, and we're looking at shoring up the numbers in the health sector when we're talking about the physician associate. Our guests are Mr. Mohammed Hassan in Kano and PA Mayomi Abimbola in Dallas, Texas. I'm coming back to you, Mr. Hassan, and I want to ask you, you specifically said that you generate your own money and you will not be a financial burden on anybody and all that, but will the PAs be paid from this money? And if not, what do you think about a uniform salary scale for all healthcare providers?
Well, from the content of the bill, it was emphasized that the entire operation of the physician associate is going to be based on collaboration. You know, we have to understand right from the onset that the main idea is to provide training, sufficient training to this physician associate so that they will be able to support our medical doctors, particularly in rural areas. So if we don't know what will be the outcome of the legislative process, by the time it is accepted by the parliament and it is processed, the committee, the relevant committee that will be handling this issue has leverage, has a lot of power to either upgrade the institute, you know, so that it will, for example, there are so many institutes that started on their own, and later on, when government realizes the significance of such institute, they now upgrade that institute to be a government outfit. But without necessarily relying on that outcome, let's leave it the way it is. It is going to be an institute that will stand on its own, generate its own revenue. So, of course, there are going to be unemployment. They are going to pay salaries for those employed. But if you look at the members of the institute, they were not appointed. They are not going to be appointed. They are going to be elected at the general meeting. So, well, of course, the issue of salary has to be addressed, but there's the way we are going to accept it now. It is going to be like an enterprise in the sense that it is going to employ their own people and then pay them their allowances and salary through the revenue generated by them. System of payment of salary. So we cannot predict what will happen now, but I believe it is going. Yes.
Let me quickly put a question to him. I can see that a lot of thought has gone into this, but I am curious, you know, back in the 60s, it was medical personnel who had come back from the war that were trained as PAs. But here you are saying that anybody who has gone to the university has a first degree can apply, even in the arts. How you know, feasible is this? Is this wise?
Before I answer that, please can I quickly just chip in that the PA profession we are talking about in Nigeria should be self-funding. It should be the Chartered Institute of our PA should be self-funding. Yes, the government, there is need for enact it into law and jumpstart the whole program. And thereafter, that institute should be able to fund itself. However, when this particular workforce, if anybody get employed by an hospital, that hospital is supposed to pay the PA. So it's a great workforce that will generate a lot of employment for a lot of people. And the people can transition. For example, somebody that studies biochemistry can go to a PA program for do the two-year PA program and become a PA, and will be able to practice as a PA after passing the board exam. So to answer that question concerning the evolution of our PA profession, yes, it started within the military. You know, the few people were trained initially to be able to practice as a PA. They did not go through any formal education. They just went through some training. So, but there has been a lot of evolution. At a time, you have to go through the 4-year college to become a PA. So at this time, even if you are, there's probably 1 or 2 universities in Nigeria, in the US, that are kind of allowed to the grandfather then to graduate PAs with bachelor degrees. Otherwise, everybody has to have a master level degree. So the master level degree at this time, there's, like I said, there's been a lot of evolution, but at this point, you must have a master degree before you can practice as a PA. As a matter of fact, there has been some conversation about probably making it a PhD program that such that before you can practice as a PA, you must have a PhD in physician associate studies. But this is still just talk on the table at this time in the US, UK, and elsewhere. It's been a PA, a master level degree.
Okay, in 30 seconds, what time frame are you looking at to make this happen in this country?
So the expectation is that if this law passed the Senate and the House, I believe that within 24 months, we should be able to crank out PAs, in Nigeria. Like I said, so over here in the US, more than 150,000 PAs practicing. In Kenya, we have more PAs than medical doctors in physician clinical associate in Kenya than medical doctors. So this is a workforce that will be able to help tremendously, our healthcare access in Nigeria.
very much. Thank you so much for coming to the show. My guests, PA Mayomi Abimbola and Mr. Mohammed Hassan from Kano. Thank you so much for coming. It's been quite an educative half hour. Thank you also for being there at home. Have a wonderful day. I am Mary Alale Yusuf.